So hello again, everyone. Welcome. My name is Lamecca Holmes. I'm the director of the East Flatbush Community Partnership. And thank you for being with us for our monthly meeting for November. We have our agenda lined up for you. I'm going to share that. We have our words of encouragement. We have our East Flatbush Community Partnership updates, as well as our What's Happening segment. We're going to have 3 presentations today. One from Salma Salim, one from Rumel, another from Brooke, and then we have our program updates and next steps. Okay, so with that said, Randy Williams, are you with us?
I am with you.
Hi, Randy. Feel free to lead us off with some words of encouragement. Thank you for being with us today.
Sure, thank you for having me. I guess I always like to remind the people who are closest to me that life is a journey. A lot of times we set out and we start to do things and things fall along the way. If you were like me as a child, you probably played every instrument. You probably sang on every group you could, and things just never became anything. And as an adult, what happens is we keep those childish ways into our adulthood. So we start a lot of things and we don't finish a lot of things. But let me encourage you that every day is a good day to start over. Every day is a good day to try again. One of the things about life is that it has its ups and downs. The only constant in life is change. I think when I was younger, if I had grasped that, I wouldn't have held on to some things too long, wouldn't have fought with some things too much. Remember that life is a journey. Enjoy the journey. Enjoy every moment. Enjoy everything. Create memories. Have fun. I mean, we all work hard. Work is going to be a part of life. We all have to concentrate and focus. And then there's just times where being lazy and a vegetable is okay. And nothing is wrong with rest. Nothing is wrong with taking a moment and listening to your body and just taking a little mental health time for yourself. I think a lot of times we get so consumed that we don't remember ourselves. My encouragement to you today is give yourself the same patience and love that you share with everybody else. Give yourself the same self-care. Give yourself the same it's okay that you would give to other people. A lot of times we just get so heavy and hard on ourselves. And sometimes it's okay to tell yourself it's okay. I don't think we do that enough, especially those of us who are goal driven, those of us who have deadlines we have to reach. Sometimes you just got to tell yourself it's okay. It's going to be there in the morning. It'll be there later. I'll get back to it. But for right now, I'm gonna laze out and get some water and just sit around for a second. I was taught in a business conference one time that when you work an hour, you should give yourself 5 minutes. And I know that doesn't work with adherence for those of us who do customer service or anything like that. But in life, you should give yourself that 5 minutes. Give yourself 5 minutes to regroup. Give yourself 5 minutes to just recapture your aim, your focus. Give yourself that 5 minutes. And in conclusion, grab a pen. I think a lot of times things fall by the wayside because we just get burdened down with new stuff. There's always a ton of stuff happening. Grab a pen and write down those goals. Grab a pen and write down what you want to accomplish. I was told that very wealthy people touch at least 5 important topics a day. Right? So grab a pen and write down, what is today's goals? What is today's things I want to get done? TD Jakes said, there are people who wake up in the morning and say, okay, what's going to happen today? And then there are people who wake up in the morning and say, okay, this is what's going to happen today. So I encourage you, take it a step at a time, take your time and enjoy every minute. That's all.
Randy, thank you so much. We appreciate you joining us and sharing those words of encouragement. Thank you.
You're welcome. Thank you for having me. Thank you so much.
Okay, we're going to continue with our agenda for today. Up next, we have our East Flatbush Community Partnership updates. Cindy?
You didn't live this strong, this long to get put on the.
Everyone. Cindy here, community organizer with the partnership. And for our updates, we continue to share the administrative assistant open position that we have. The responsibility of the administrative assistant with this is to provide administrative stuff and clerical support to the partnership and basically broaden the partnership's social media reach. We will put the link in the chat for everyone to continue to share this opportunity, and we're hoping that we can fill that position soon. For past events, I think it was last week, we held Open Door. Open Door is held on the second Thursday of each month. During the last meeting, attendees received information from the Mayor's Office of Immigration Affairs. During the meeting, the presenters shared some amazing information about health and social service resources, including healthcare, COVID-19 testing and vaccine information, food assistance, tenant protection, and some legal, free legal help also for New Yorkers, regardless of immigration status. The next Open Door is on December 8th. Heard at Home Community Conversations in collaboration with East Flatbush Community Development Corporation and Flatbush Seventh-day Adventist Church. We continue to host Heard at Home Community Conversations, which is providing a monthly opportunity for East Flatbush residents to discuss community issues, engage with elected officials and organized groups. On November 15th, we continue that initiative where we were joined by the Center for Law and Social Justice from Medgar Evers College, a representative facilitated workshop that deepened residents' understanding of civic engagement. Attended residents was also connected to social services such as Home Base that provide homeless prevention services, the Mayor's Office of Immigrant Affairs, also the Brooklyn Adult Learning Center and the Civic Engagement Commission. And for our upcoming events, we have two. We welcome you to share the opportunity, which is this Saturday, the 19th. The partnership will join Hope Community Development Corporation, Young Invincible, and the New York City Health Department with a Thanksgiving food distribution and flu/COVID booster vaccines give-outs. That's going to be at, sorry, Lamecca, at 414 East 95th Street between 10 a.m. and 2 p.m. And then on December 3rd, in partnership with Sesame Flyers, the Arts and Public Speaking Program and Playground NYC, we welcome the community to join us for our annual gingerbread house party on December 3rd from 10 a.m. to 2 p.m., during which we will provide a brunch for the kids. We will also have gingerbread house and cookie decorating and some other fun activities during that day. I'll put the link in for that as well for registration. Space is limited. That's all. Thank you.
Hi, my name is Kai Prayer, and I'm a community ambassador for East Flatbush Community Partnership, and I'm going to explain what's happening in the community. On Tuesday, November 8th, New Yorkers voted to approve Proposition 1. It's the Clean Water, Clean Air, and Green Jobs Environmental Bond Act, passed with roughly 68% of votes. The act allows New York State to borrow $4.2 billion to pay for projects that will improve water quality, conserve open spaces, reduce flood risk, and climate change with resilient infrastructure. New York City schools are receiving $12 million in funding to boost support services for the recent influx of asylum-seeking families and their children. The city's announcement comes after Mayor Eric Adams proclaimed an emergency procurement declaration in late August to swiftly acquire additional shelter and services for individuals and families seeking asylum. Lastly, an abandoned church in Flatbush to become a creative hub performance venue. Located at 494 East 23rd Street, the new community hub will have an 800-person capacity, housing cafe, retail space, a restaurant, and a gallery. The church will consist of multiple performance venues, 300 workspaces, and a recording and artist studio. Thank you. Also, I would like to remind everybody to please put their names and email addresses in the chat. Thank you.
Good afternoon, everyone. I'm Diane Smith. I'm also a community ambassador with East Flatbush Community Partnership, and I've been charged to present our presenters. Our first presenter this afternoon is Salma Salim. Please forgive me if I mispronounced your name. She is the Senior Job Developer of Career and Education Programs with Cypress Hills Local Development Corporation. Salma, the mic is yours.
Hi, everyone. You said it right, Salim. So I'm just going to present. Can I have the screen? Oh, yeah, I can present the screen. So I'm going to present what we do here at Cypress, especially the CNE program. So the CNE network, our slogan is connect, advance, and achieve. And our target audience will connect with us as a network, advance through training offerings, and be supported by wrap around services to achieve their career goals. So what is CNE Network? CNE stands for Career and Education. The CNE Network provides a clear pathway into living wage employment in careers with high growth potential in New York City. We specialize in supporting young adults who are ready to excel in the workforce by providing customizable training sequences, one-on-one coaching, and other career development services. Our members gain educational and economic success and develop leadership skills to transform their lives and community. So this is a navigation map, how we work. We're going to discuss in details what our programs are in the remaining slides. So we start with our core training and internship program, which is called Champion. All 18 to 24-year-olds begin with Champion. Some folks might need their HSC or GED to be eligible for our advanced training options. Folks that are 25 years and over will start with advanced training options directly, since Champion is only catered to 18 to 24. All of our programs have job placement support and follow-up services. So Champion. CNE started off with Champion alone, and over the years, we've included other programs. So Champion is a train and earn program catered to 16 to 24-year-olds. Usually the intake process consists of a information session, which is virtual and online application, and then an interview. The program is in person Monday through Friday, 10 a.m. to 3 p.m. And the core training offers professional letters, financial literacy, social emotional learning, workplace rights and responsibilities. They also have an occupational training where they get their customer service and sales certification. And then they have the option to enter an internship to work 175 hours, and we pay them $18 an hour. So they can either do the internship or go straight into an advanced training or job placement assistant or follow-up. And we do give them incentives and stipends. So they get MetroCards to come and go. They also get up to $1,000 in follow-up as well. Our other programs are Careers That Care, which is our healthcare program. Their eligibility is that they need a high school diploma or a HSC, proof of vaccination. They also go through an intake process, which is an online application, interview, and a tape test. The program is an in-person model. Currently, we partner with Kingsborough Community College, and we offer CNA and patient care technician. So anyone who comes in this program has to go through CNA first, and then if they would like to continue, they go into the patient care technician, which certify you in EKG and phlebotomy. We also have, well, the incentive is that they have the training scholarship, and then they also have job placement assistant and follow-up up to a year. We also have a program called Teach. It's a CDL program. The ages are 18 plus. Did I go over age? Okay, Careers That Care is also 18 and up. Teach is 18 and up. You have to have a valid driver's license. The intake process is a pre-screening. You do an in-person application, and then there's a driving record review. The program is in person. It's 2 Saturdays where we help prepare folks for the exam. And then there's job placements at Access a Ride company, and then there will be follow-up. The incentives for 18 to 30-year-olds are a $150 license and testing free reimbursement. And then lastly, I believe, we have a program called Buildings New York, which is our construction program. It was only for folks who are 18 to 24 and reside in New York City, but recently we were able to go up to 25 and up. So there's no age limit for those who reside in the following zip codes. Proof of vaccination is required. The intake process is an in-person application. We provide their OSHA 30, their SST, their scaffolding, flagger. And then we also have partnerships with some developments where they will be directly placed into work, including Building Skills, if anyone has heard of them. And then Building Works is another one as well. It's for 18 and older. They need to have their high school diploma, 8th grade level tape. They have to be physically be able to work, be legally eligible to work in the US, proof of vaccination. They'll have an intake in person. And then the program gives them a 6-week pre-apprenticeship, their OSHA 10, the 40-hour hazardous waste worker, CPR, and scaffold awareness. And most recently, we partnered with Perscolas, where folks who have a high school diploma, passed their tape, and are legally able to work and have their vaccination are able to come in, do an online application, go through an interview. This program is 12 weeks, Monday through Friday, 9 to 4, and they get a certification in CompTIA, Google IT, and then since Perscolas is known nationwide, they also support with IT job placements as well. Usually, for those who come into any of our programs, we need a valid ID or passport, their social security, proof of public assistance if applicable. We support them in applying for SNAP or any other resources if they do need it. Their driver's license for Teach. They, again, require high school diplomas for Careers That Care and Building Works. Their proof of vaccination, and then if they have, well, the males have to sign up for selective service registration, or they have to be aware of their SSR ID number if they are coming to Champion. So how can you join? I think we make it very easy for folks to join. All you have to do is, click on this link or use this QR code to sign up. We primarily target our audience or would like young folks, 18 to 24 for Champion, who are out of work, out of school, and they're not currently enrolled in college. And the easiest way to refer someone is to just collect their basic information, full name, email, phone number, and emailing championinfo@cypresshills.org. And we'll take it from there by inviting them to our weekly info sessions. So I'll definitely be sending this presentation over so that maybe Cindy or Lamaka, I'm sorry if I'm butchering your name, can send it over to everyone. But yeah, anyone who is interested in sending folks to any of our programs, please let me know. Or again, the links will be, the emails and the QR code will be put in the presentation.
Thank you. Does anyone have any questions for Salma?
Are your programs only in Brooklyn?
Yes, so we host most of our programs within our new community center, right off the J train on Crescent. I don't know if you know of that area. But yeah, primarily in East New York, our construction program, we do kind of change locations, but still staying within East New York.
Any additional questions? Okay, Salma, thank you so much. We can
Thank
definitely
you.
send out the presentation. Thank you. Okay, I'm gonna put up the slide for our next presenter.
Okay. Thank you for that good information, Selma. Okay, our next presenter is Jay Rumel Parkin. He is the Executive Director and Chair for Help NYC. Mr. Parkin?
Thank you, Diane. And could I get sharing privileges? Oh, I just got them. Thank you.
You have but to ask.
Yes. You ask and you shall receive. Hello, everyone. And I am Rue Parkin. I am the Executive Director of Help NYC. And I would like to thank Cindy and Lameka and Diane for inviting me here today. I was excited to be added to their email list. I did not know I was on there. So thank you for knowing about us and inviting me here. I have two presentations today. One is our old presentation I have updated, and then the second one is the new format we're doing. The new one is much more entertaining to watch, so I apologize for this very boring old presentation I'm going to give, but the data is correct. I just want to set up, I am a person with lived experience with mental health and substance use. I'm currently in recovery, and I also was street homeless for over 2 years in the early 2000s. I'm a public advocate for those who are unhoused and experiencing street and shelter homelessness in the city. And I'll start. So Help NYC and who we are. We are a collection of New Yorkers across the city. This is not our entire team. Our team fluctuates from week to week. But we all have lived experience accessing public health services and social services here in the city. We all have direct experience being homeless or being in recovery from substance use or mental health challenges, and also maybe homelessness or some type of experience that has had us use the public health or social services here in the city. What we do is that we advocate to lower barriers to entry-level services and lift the lives of underserved New Yorkers. And we work in the realms of human rights, the personal dignity, the right to choice, using our lived experience to help others, and harm reduction methods. Our primary program here at Help NYC is the Help NYC Resource Navigator. Some of you may know this. And this is what the majority of our work and why Help NYC exists. I started this as a text message to my friends in recovery back in 2016 that listed like soup kitchens and detoxes and mental health clinics that I knew could accept people in the moment. And that turned into a Google document that I just sent the link out to because could you imagine? I had, I think at one time, 10 messages that I would text to someone, and I just got tired of doing it. That turned into a personal blog that actually I blogged about my personal experiences with mental health or substance use or being dually diagnosed and having untreated ADD and PTSD, and what does homelessness look like, and what does housing look like? So my experiences are hot topics. Like I used to get political on it as well. I can't anymore because we're a 501c3. But a bunch of bigger direct service organizations came to me and said, hey, our social workers use this. Can you please professionalize it? And that's in 2018, helpnyc.info was born. We are not the city. We are a separate nonprofit. Our branding looks like the city, and that is entirely on accident. We did not try to brand like the city, but it does give us some cred in the city sometimes. And we only list verified safe low barrier programs. Does anyone here know? Oh, let's go to this first. So I explained a little bit, but we actively use technology and best practices and language and other methods to eliminate the barriers to why and how people access services in our city. And our website is even low barrier. Not only do we require our partners to be low barrier, but our website, we lower barriers to access us. So we've worked with Google. We've been in partnership with Google for about 4 years now, that they have created a template for us that actually re-renders itself depending on the device. So have you ever accessed a website on your phone and you can't use it because the directory won't load, or it's taking too long to load, or it just 404 not found? Google has created this template that it will load on any device. If you have a government subsidized phone, it will load on that device, because those devices usually don't have the processing power to load the bigger websites or the bandwidth. So we try and make our website as enabled. And this is not announced yet, but we will be on all the links, the link towers in the city, across the city. We'll be the resource navigator on there, probably starting in late November. We're having some bugs right now with their tablets, but we're working on it. Does anyone know what low barrier means? We hear about low threshold a lot. Like, you have to meet these program goals or you're going to get kicked out, or if you're in substance use, if you relapse, you're going to get kicked out or you have to go to rehab. That's not what we're talking about. What we're talking about, what are the barriers to someone getting services from their organization? It could be agency barriers, like, oh, we don't serve that population, or it's requiring a government issued ID rather than a shelter ID, or proving identity through a bill or a birth certificate. We really drill down into these barriers with our partners because we want to make sure that the person has a successful first contact experience. And what we define by success is that they get enrolled in the program, or there is some reason other than what we presented to them that they were not able to access that program. Right now, we have 322 listings listed across the city. We have 226 active listing partners. We cover, actually, this number is wrong. I think we're at 67 different service types now. And our website translates automatically into 33 languages spoken here in New York City, with the ability to be translated into, I believe, 119 now dialects and other languages spoken here in New York and across the world. As of today, we have over 45,000 people served here in New York City. We have around 6,000 active users a month, and our return rate is 59%. That return rate is notable because what that tells us is that people use our website and find it effective. For resource directories here in the city like HeightSite, Aunt Betty, My Bronx Impact, their return rates are around 11 to 12%. So people are finding accessing our website very helpful and very dependable. Here, I just updated this today. Our top 10 resources right now has always been food assistance up until the monkeypox epidemic, MPV, happened in June and July. And then that was huge. We've never had anything go above food assistance. But case management and benefit access programs, and some of our partners, two of our partners I can think off the top of my head that we have in East Flatbush right now is Church of God of East Flatbush. They have a community kitchen there. And also the Hope Center Development Corp, which you guys probably know. They've been a partner with us for at least 3 years now. And we do special campaigns throughout the year. The next presentation I'm going to talk to you about is our Holiday Meals and More campaign that I really hope y'all will get involved in. But we also have a voting initiative, and this year we focused on registering people to vote who are unhoused. Because look, people don't know here, or in the United States in general, even if you are experiencing homelessness, you can still register to vote, and you don't need an address. You can say, I live on the corner of 59th and Lexington, and that's the district that you'll register in. Or you can use a shelter address to register. You do not need to be housed to register. So we really encouraged and helped support those who are unhoused in our city to register to vote, because it's very important. We have our monkeypox MPV campaign going on. I need to update that graphic because we don't call it monkeypox anymore. And we have two public health campaigns. One is for COVID and one is for MPV. And we also are a founding member of the Homeless Rights Month here in New York. Those are major campaigns that we do throughout the year. The helpnyc.info resource navigator is available at helpnyc.info for anyone to use now. So great. We do organizational support and advocacy. During the pandemic, we created a guidance document with the IRS and several stakeholders here in the city to help people who are unhoused get information on how they could get their stimulus checks, whether it was an ID they needed, a debit card, a prepaid debit card they needed, or a bank account. We worked with our partners to do it. We also, an initiative is spelt wrong in this slide. It's driving me crazy. It's everywhere. We put it up before we checked it, but we're correcting it. We have the Housing Voucher Initiative that is going to be educating voucher holders in January, February about what vouchers are, what's the timeline of becoming from homeless to housed, and also we partner with Neighbors Together, which I believe is near East Flatbush. I can't remember exactly where they are, but we're in partnership with them, and they're going to be educating landlords and realtors about vouchers, so when people present vouchers to them, they aren't denied. And just so you know, if you have a housing voucher and if you have ever been denied by a landlord or a realtor to get housing, they have discriminated against you. It's called source of income discrimination, and please report it. And in questions, I can answer where you can report it. We also do a lot of advocacy. We're supporting the Just Homes project in the North Bronx right now, which is around 70 units of affordable and supported housing that the community is very against. So we're trying to do some public education campaigns with directly impacted people. We do the Homeless New Yorkers Day of Remembrance, which I hope you will join us this year, where we read off all the names of those who died due to homelessness in the city. That happens on the winter solstice, which I think this year is the 22nd at Grand Central. Please come. And we also do campaigns with the mayor's office and public speaking for projects mainly around homelessness and food insecurity. I already spoke about the Housing Voucher Initiative. And networking, we provide events where anyone can come. We have a holiday drag bingo coming up at Stonewall Inn on December 1st. We did not coincide it with World AIDS Day. It was a mistake, so I'm everywhere that day in the city. But please come to one of our events. We also provide outreach kits. I can send some up to anyone or any of the organizations here today. Please let me know. I don't have one near me, but we have little cards, we have flyers, we have posters. Please, please, please reach out to us. And if you are having an event, please invite us. We have a mobile kiosk we can bring to your event and do some outreach. We're doing a lot of outreach. We got a grant to do a lot of outreach next spring and summer. So any questions about the Resource Navigator before I jump into the campaign for this holiday season?
Ru, are you able to actually show the website? I just checked it out and I think it's great. I think it'll be good for just people to have the visual. Thank you.
No problem. So we just go to helpnyc.info. .org is our organizational website. But this is the landing page. For instance, and one thing that makes us unique is we list in a person first way. We are person first, system second, which most resource navigators are agency first, person second. So you can search our website up at the top, say I want to find the Hope Development Corporation, it'll bring it up. But you don't have to, and it's intentional this way. So I need food tonight for dinner, or I need food next week. And it is Thursday at 4 o'clock. So I'm going to click on, I'm in Brooklyn, so I'm going to click on food pantries, and today is Thursday. So right now the Greenpoint Hunger Program is listing. See how fast that was? Who here has gone to a resource directory and had to search. Or click on a resource map and like try and figure out who's serving today, when, and where. It's a lot of time. Within 15 seconds, I got the information. And all of our food listings are listed like this. So the Brooklyn Community Kitchens. And it also gives you a map here. It tells you what time it's listed by borough. I'm sorry, service type, borough, day, and then time. So these are all the programs who's serving today. So St. John's Bread and Life served this morning, and then Neighbors Together had lunch at noon, and then they're serving right now, or will be at 4 o'clock today. There are some other things here. This is the campaign I'm going to talk about shortly. And personal hygiene. If you need some personal hygiene help or need some toiletries or something, most food programs don't provide them. So this is a great way to get shampoo and stuff. And here's our health and wellness. We have a bunch of stuff here. Helplines, mental health resources, substance use recovery resources. And here we list different types of treatment programs, 12-step fellowships, recovery lifestyle, which are sober lifestyle that anyone can enjoy, where there's public events or nightclubs that do not involve alcohol or substances here in the city. And then self-help groups and resources and medication-assisted treatment and also harm reduction programs, syringe exchange. So we're pretty expansive in what we list. We just started listing sexual health resources. We do have, and here's our public health campaigns that are going on right now. Focus populations. Oh, gotta go back. We also have focused populations, so homeless resources. But all of the services that are in our general listings, anyone can list. And for instance, there's an organization here in the city that accepts public money. And we found out that people of trans experience were being referred out to HRA to submit a SNAP application. I don't care who you are. There is no reason to be referred out to HRA if you are being paid to register SNAP recipients, food stamp recipients. So that's how dig we deep into these organizations, and we don't list programs like that or any type of discrimination. But we notice that there are certain populations here in the city that need targeted services, that those population services are designed for them. So we have listed them. We have domestic violence coming out soon. We're working on language translation for the migrants that are coming to our city to connect them with organizations that are experienced with that situation that they're experiencing right now. So any other questions about navigation?
No, but there's some questions in the chat. Would you like to take them now or later?
I can take them now. Sorry, I don't have the
Okay.
chat.
One of the questions is, are the resources updated in real time?
Yes, they are. So what happens with the updates with us is that each listing is required to check in with us at 30, 60, 90, 6-month intervals. Some soup kitchens check in with us every 14 days because their service times changes. So they are updated. And if a program misses that check-in, they automatically get an email saying, hey, email us, check your listing on our website. They have the link and everything. And if they don't check in with us within 5 days, the listing is removed from the website. We don't mess around. We don't want to be the biggest. We don't want to be the most flashy. What we want is to be the most accurate and to serve people the best way we can. Because having outdated information, I take that very seriously with our team. If I catch wind, before I even check the database, I go in and yank the listing off. Because it is a bigger disservice to have wrong information on a website than anything. And this comes from a direct experience that I had when I was homeless. I'm a big guy, I'm 6'4", I'm 400 pounds. I can't find winter clothing like most people can. And I was in the Stadium shelter here in the Bronx, and I had a really hard time trusting shelter staff. I would rather be on the street than be in a shelter, but I needed the housing, and at that time, that's the only way I could get it. And my case manager, bless her heart, tried her hardest to find me clothing, but the only place she could find me clothing was, I think it was in Flatbush or East New York. It was way out there. It took me like 2.5 hours to go because you need a passport to come in from the Bronx to go to Brooklyn. Sorry. But I went out there on my last Metro card. The building was not even there. It was an industrial area and the building was leveled. I did not return to the shelter, lost everything I owned. And that was actually the next to last time I was in a shelter, because BRC found me in a snowbank in a cardboard box that winter because I could not. And that's how important these listings updated are important to me, because having the wrong information could kill someone. And I do not want that happening to anyone, because we already get enough my fellows and my peers that are experiencing some tough times right now. It's a full-time job to be homeless or in recovery. And why add any stress or pain to that experience for them? So sorry, that was a long-winded. I'm very long-winded. What's the next?
That's okay. Thank you. Another question we have is, how do we connect with you to table at an event? I'm sure you can put your contact info in the chat for that when you have a chance. The next one is, are there any requirements to receiving these services?
So each program has their own requirements, and we try as best to do to be transparent about that with our partners. Every listing will have every listing will have a program detail, and then the requirements, any restrictions that they have, and for instance, this is a medical program, so what insurances they provide. Just trying to think anything else that. Let's go back to the food listings. For like the food listings, it'll say generic or general. It'll tell you it's a sit-down hot meal compared to a takeaway hot meal. So we try to give you as much information so you're prepared. But I always stress, please contact the program before you show up. And if it doesn't say walk-in, if it says no walk-ins accepted or require an appointment, please call them or email them or however the listing tells you to connect with that program. Please follow that, because we want you to be successful. Another note is that we do not provide any direct services right now. We are planning next year to do outreach clinics, resource clinics, where people can come and meet with our staff to get referrals, or have some legal people and housing people and advocacy people there for them to connect with as well.
Thank you. So Vanessa, I might need you to help clarify this question. Vanessa wrote, for providers, are the services free? Do you mean to be listed on their website? Could you clarify that?
Yes, sorry,
Okay.
look, I came in late, so I just was getting the tail end of it, so a gist of it. So I just wanted to know, for providers, if we try to get our information on the system, does it carry a cost or anything like that?
No, this
Good
is
question.
completely free to direct service providers. And it's open to organizations, community groups, and mutual aid groups. Really, the only requirement right now is that you have to have a weekly or daily schedule, or a monthly schedule that is clear. We don't have the ability to do one-off events yet. We are going to be launching a community calendar coming up in February, where you can list one-off events, but that's in beta form right now.
Okay, there are no more questions in the chat.
Ting has her hand up.
Ting?
Hi, everybody. This is Ting from NYC Votes. We are the voter engagement initiative of the New York City Campaign Finance Board. And thank you for this presentation. All these resources are very much needed. And so for us on our team, we have a voting rights and accessibility coordinator who works with like disability and criminal impacted communities. So we would really love to connect and work with you on the voter education initiative that you have. We offer workshops. We, can also table outreach events, presentations, etc.
That would be awesome. I put my info. We have worked with the elections board before, and 2 years ago we were with New York City Votes, and then we lost our connection due to the pandemic.
Okay, we'll get it back. Yeah.
So yeah, but definitely, I'll put my information in again for the people I believe it was Vanessa that asked if you want to list with us as a listing partner. So we have a couple of types of partnership. Listing partners list their services on the website. Community partners and advocacy partners, that goes on our main website. But if you want to become a listing partner and list your programs on our site, you want to go to the bottom of the website and under partners, click listing partner resources, and then click become a listing partner. And this will tell you everything, frequently asked questions, everything about the listing program and what we require the partners. And then you would just click schedule a meeting and you can schedule with one of our team members. You may get me, you may get someone else. It's random, whoever gets it assigned. Anything else about the Resource Navigator before I talk about our holiday meal?
I have a few questions. One, I love the website. I'm a job developer, and it just sucks sometimes when I can't reach a real human being. So like what you just did with the scheduling, I love you for that. You're my favorite person ever. But before I even ask the question, are you going to talk about housing and shelters a little bit? Or
I'd like to know.
So I was a case planner before, and from my experience in working with like my clients, there was like a long waiting list or like eligibility or like it's not convenient to like look for shelter hours, like even to like sign in like walk-in shelters. So do you guys also list those resources as well?
We do. There is changes, thank God, finally happening at DHS and HASA to update that. But I will point this out for homeless services. I have two screens and I was trying to bring everyone down so I could just look at them instead of doing this. So emergency housing can be found here. In New York City, if you don't have experience with shelter system, you have to go through general population first. And these are all the general population intake shelters that are here in the city, broken down to what type of population. So adult families with or without children, single adult women, single adult men. And this is what you identify as gender.
And these are just like resources that you guys know of, not necessarily like partners.
Everyone's a partner on our website. So these listings have a person behind them.
Okay.
If we hear that Franklin Shelter isn't doing their job, we can advocate for that person.
Right. So that was going to be my next question. So if someone finds these folks on your website or like through you guys, is there like a priority because they worked with Help NYC?
No.
Okay.
No. We are like a telephone book.
Okay.
That you just look up information on. We provide no direct services right now.
Okay.
But
okay.
If there's an issue with one of our listings, please let us know, because that means that we've missed someone and we need to reach out to that program and say what's going on, our information's wrong, so we can update it.
Okay, great.
What happens most of the time what happens if we hear of a listing that is wrong, we will go in and pull that information off the website first, re-verify that listing with our partner, and then repost it.
Okay, makes sense. Thank you.
Yeah. And also, since you work with job development and everyone on this call, we have a partnership with Resume.io. I don't know if you guys know what Resume.io is, but it is a powerful resume creation tool that will help you create cover letters, resumes, and track references. Also, it will help you track job applications, and you can directly apply for jobs in Indeed, Monster, and ZipRecruiter through that platform. The value is about $150 a month, and we're offering it free premium membership for 1 year, but you have to sign up through us. And our goal is to reach 100,000 New Yorkers and get them on the platform. I'm running out of time. How much time do I have left?
You have about 20 minutes because the other presenter didn't use all their time, so you're
Oh,
good.
thank you. So any other questions about the Resource Navigator? The only wrong question is the question not asked. And I noticed CCRB is on here. Margot, you're here. If you are experiencing income discrimination when you are have a housing voucher and are denied due to you being a voucher holder, contact CCRB. They're the agency that handles income discrimination in the city. What else? So
I'm sorry, correction. Did you say CCRB?
CCRB, yeah. Oh, sorry, wrong. The Civil Rights Board.
Okay.
Sorry,
I was going to say that.
I am so sorry. I saw your name and then I saw the C. That is the wrong place that you want to go.
No worries.
That's if you have a problem with the NYPD.
Right.
Sorry about that. That's embarrassing. And it's recorded, so it will live in infamy. This is our organizational website, but something I wanted to point out on here is if you go to our work, this lists all of our work, but if you are a voucher holder, landlord, realtor, please visit this website. I'm going to put it in the chat right now. Yes, CCHR. Thank you. Thank you, Abraham. I got the first maybe 2 letters right. So here it is. What we're doing right now is that we're creating a landlord's directory. We're not having much success with it, but we're working on it. So we're trying to find landlords, realtors, and property managers that have experience accepting vouchers. So if you are a person that is successfully housed under a voucher program, please reach out to us because we want to know who your landlord and realtor you worked with was, so we can outreach them and just build a network of realtors. Because if you've ever been homeless and you are handed that realtor list, it hasn't been updated in 15 years. I think one of them I saw recently, the last time it was updated was 2004. And I'm like, 90% of these people aren't practicing anymore. So, yeah. So let me talk about our holiday meals. Just let me switch screens here. So this is one of our biggest events we have every year, is the Holiday Meals and More campaign. I'm going to skip through a lot of it because I've already done some of this already. So this is just some more events that we do every year. We're doing the Just Homes this year already. And then we have our garden party every year. Here's the new MPV logo for the monkeypox campaign. We also do emergency relief response. We're part of the Twin Parks fire. And we activate all of our partners in the city, in that area of an emergency response, and get them to the scene as soon as possible. Here's the Homeless New Yorkers. We're also a founding member of the Homeless Rights Month. And here's our outreach, some of our outreach team doing community outreach. So we've already done this. And we have this campaign, the food assistance campaign that we do that we call the Holiday Meals and More, is split into 2 sessions. Right now, we are in the Thanksgiving session that lists turkey giveaways, food distributions, events, and everything. And then our second session will start December 1st. That will list any holiday events, and we cover Christmas, Christmas, Hanukkah, Kwanzaa, New Year's, and any secular events with a holiday theme or resource fairs that happen in the month of December. As I mentioned, these are the type of events that we list under the holidays. And then it could be food distributions, hot meal deliveries, mobile food programs, free stores, toy and gift distributions. A big one is winter clothing distributions that we're trying to list this year. Parties, any community parties, events, any events that you hold during December, and free or pay what you wish city attractions. So like the Macy's Day Parade, the tree lighting, Rockefeller Center tree lighting. I think we're doing the Brooklyn Library tree lighting. Any events in your community, please, please, please let us know about them so we can get the word out for you. The events that we do not list are anything that requires an admission or donation to participate in. Participation in a sales or marketing presentation. The insurance companies are famous for this one because of Medicare enrollment in December. And we don't list anything like that. We don't list anything that requires you to participate in a religious, secular, or political ceremony, lecture, or services. And anything that's not focused on certain populations. This has a caveat to it. Recently, we had a organization come to us, want a list that only listed events for mothers, expectant mothers, or single mothers that are in DV situation, domestic violence situations. We would not list that event because it's such a focused population group. Our holiday events are very much general, everyone can attend them type of idea. But we did connect that organization to our partners that work with people experiencing domestic violence. So if we say no to an event or a listing on our website, it's not the end of the road for you. We'll meet with you and say, hey, this is where we think you would be best fitted to get your information out about your program or event. If you discriminate or exclude any New Yorker from your program or services based on what they believe in, you don't list with us. We're very strict about that. And then if there's requirement for participation in media events, like you're standing behind an elected official and that's how you're getting services, we don't list that. And if it's held in a private home or business, we don't list that either, with the exception of some of our listings, like the Bloom event out in Brooklyn. Freedom does cook the food in her home, but she serves it on the sidewalk in her neighborhood. So we would list an event like that. And the highlights listings are free as always with us. And this is unique to this campaign. You do not need to be an established Help NYC partner. The criteria for listing your holiday event isn't as strict as a normal listing on the Resource Navigator. And it has to be held in New York City, or your virtual audience is targeted for New Yorkers. Events have to be free. All listings are reviewed and verified through public means, or we'll reach out to you directly. And listings are not partial. We're not partial to any secular, denomination, political organization, or institution, public or private. Everyone is encouraged to list their events with us. And this is the information to have on hand. This is already on our website. Just all the information out here about your event. It'll just make your listing process, filling out the form, better. And please list yours. You can click that, hit that QR code right now, or just go to helpnyc.link/holiday listings. And please give us time ahead of your event. Like, your event is tomorrow, list it with us, but we can't guarantee to get on the website. So please give us like 3 days of lead time before your event, if not more. If you know the event is happening and you have all the details, please register it today. If you know you're going to have an event, but you don't have all the details, please pre-register it. There's an option to pre-register your event, and we'll reach out to you closer to the event date. Or if you don't have an event date, we'll just send you a reminder every week or so to register with us until you've registered. And this is for everyone here. At the holiday website, there are posters and flyers. Posters are to hang up in your spaces or in your communities to let everyone know. Flyers are if you have packets or distribution bags, please print them out and put them in your distribution bags to let people know about this campaign. And I think that's it. So these are the important links. Please take a photo of them And if you have any questions or if you want to be a listing partner, there's my information. And these presentation links, I provided a link in the chat and also to Lamika and Cindy of today's materials and everything. And I've been long-winded and I'm tired of talking. So is there anything else, any questions or anything that needs troubleshooting or anything you have?
I have one question, Rue. What is your advice for people that we meet in our neighborhood that we believe do not have a home, and specifically sharing this with them? I'm asking because there's someone I know in my neighborhood and I've tried in the past to provide assistance and she just absolutely didn't want it. Now, mind you, she speaks Spanish and I don't, so it's a language barrier, but just in general, how would you advise like the regular neighbor, now that we know about this resource, to then share it with people we come across that might need it?
Definitely, I can share my experience on that. Is that one of the things that when I was street homeless was really challenging for me was I felt invisible. People would walk past me, not see me. People would not make eye contact with me. They would shuffle their kids to the other side of the street. And I think the first thing that we have to remember is that people who are experiencing street homelessness or homelessness in general, this is one fragment, one part of their life that could expand 80 years, if not more. And you are seeing one moment in time of that possible 80-year lifetime. And what I do today to do some self-care for me, because I am an empathetic person and I care for our homeless neighbors here in the city, I make eye contact with them and I say, hello, I'm Rue. It's great to see you. You don't even have to say that. Just make eye contact with them and nod your head. And if you can't give, if they're asking for money or food, or those gentlemen who stand at the door opening the doors for us at the restaurants, if you don't have the ability to buy them a sandwich or something like that, just say hi, thank you for being here. Sorry, I don't have anything to give you. When I was homeless, I respected and connected with the people who were honest with me. And a lot of the time, and I hear this from people who are experiencing homelessness, and when I was, is that one of the reasons that I stayed on the street is because I didn't trust anyone. And acknowledging someone's presence, they won't forget you. And they'll start trusting. But if you do have that relationship established with them, I can send you out all our outreach cards. There are flyers on our website. If you go down on our on the listing partner website, that is at the bottom. I think there's a spread the word. I can't remember if we added spread the word yet. Yeah, if you go to the bottom of the website, here, I'll show you. Right here, click posters and flyers. And here's the flyer, the quads like this. We also have them in black and white. So if you don't have a color printer, just print a couple of these out, cut them, and keep them in your bag. We also have a limited supply of outreach cards that I can send. I just have this right here. I don't have. So we have little stands. Well, where's the camera? I feel like I remember old YouTube. Oh, let me just turn off my virtual background. Give me a moment. Sorry, Zoom is not cooperating. So we have these little stands that you can put on your desk that hold our business cards. And then if you're out of business cards, you can just scan this QR code. So we can send those out. Just shoot me an email and I'll send it out to you. And also, we don't have any posters right now. We're out of them, but I can definitely send out posters, outreach kits. Here's the 8.5 and 11 poster that you can hang up in your space in black and white and color. We love the color. It's eye-catching. But we understand it's very expensive to do the color. So, yeah.
Thank you. Thank you so much. We appreciate you and everything that you shared. And thank you. Thank you for, someone said in the chat, thank you for leading from the heart. So I'm going to end with that. Thank you so much.
you.
We have our next presenter coming up. I'm going to share screen so we can have Diane introduce that person. Okay, Diane?
Okay, hi. Okay, our next presenter is Brooke Robinson. Robinson was my maiden name. We could be cousins. She's a New York outreach specialist with Young Invincibles.
Hi, thanks for
Hi.
having me. I hope we're cousins also. Okay, let me share my screen. Just give me a moment. Okay, can everyone see this? Okay, everyone can see this, right?
Yeah.
Awesome. Okay, thank you. So hi, everyone. Thank you for having me. My name is Brooke Robinson, and I am the New York Outreach Coordinator at Young Invincibles. So to start off the presentation, this presentation was created for young adults, especially because that is our target demographic at Young Invincibles. We work with folks, young adults 18 to 34, and specifically my role works with a lot of young adults who feel hesitant to receive the COVID and flu vaccine. But I hope this information is still useful for everyone, and I hope that you are able to share this with any young adults in your life. That would be amazing. And more so, if any of you work with organizations who have similar goals and think we can work together, please ping me after this meeting, and I would love to find ways to work together. So, okay. So who is Young Invincibles? We work on economic access issues for 18 to 34-year-olds in the issue areas of health, higher education, economic security, and workforce development. So Young Invincibles is a nonprofit policy and advocacy organization committed to creating economic opportunity for young adults ages 18 to 34 by amplifying their voices in the political process and elevating their needs in higher education, healthcare, workforce, and civic engagement. Our vision is that all young people fully participate in our nation's political process and have the economic opportunity to reach their fullest potential. We work in 5 regions across the country: New York, California, Illinois, Texas, and Colorado, and are based in DC. So Generation Vaxxed is the campaign that I'm currently working on at Young Invincibles. Generation Vaxxed is a campaign that we've been working on for a while now. It's powered by Young Invincibles, created to address the low COVID-19 vaccination rates among young adults. The vaccination rates we found through a study that we conducted compared to other age groups demonstrated a growing public health crisis facing young adults. And as the outreach coordinator, I'm currently working on our Generation Vaxxed campaign, doing COVID outreach and education work centered on empowering young people, especially those in communities with high vaccine hesitancies and historical healthcare inequities, to take the COVID and flu vaccine, get their COVID vaccine booster, enroll in the Affordable Care Act if needed, and encourage their networks to get vaccinated. Some of the ways that I'll conduct that outreach is a variety of ways. Commonly, it'll include tabling at local fairs, community events and gatherings, and I'll also do presentations on health education and health insurance literacy. Example, I am going this Saturday to the Thanksgiving giveaway with East Flatbush Community Partnership, and I'll be tabling there. So I hope to see some of you there if you'll be joining. So current state of COVID in New York. The BQ variant is circling in New York right now. New York is seeing mounting cases of this extremely transmissible immune-invasive BQ family of COVID variants. And it is expected to see those numbers increase over the coming months, especially for New York City. And less than 10% of the US population has gotten the new booster, which targets the Omicron strain as well as the original strain, which is really important because the less people getting this new booster, the more likely we'll continue to see the numbers rise in the holiday season. So same thing that you've been hearing for a couple of years now, back to the basics, how to stop the spread, wear your mask, wash your hands, social distance when you can, and protect yourself and others by getting the vaccine and getting your booster, especially the updated booster. So a couple quick fast facts. You can still get your vaccine at most grocery stores, drugstores, or clinics. The vaccine is still free and available to everyone. You don't need to be a citizen or to have health insurance to get the vaccine. It is available to you. The vaccines are safe and made by scientists. If you're unsure about how they made the vaccine, your doctor could provide you with more information. And side effects are unlikely. However, they do occur. And if they occur, they are hopefully mild. And they're also a good sign. It does mean that your body is building protection against the virus. Some more fast facts. Pfizer and Moderna are the most commonly available vaccines right now because they have the most updated boosters, and they have the third dose, which means the updated booster. Updated boosters are called the bivalent boosters because they protect against both the original COVID strain, the following strains that have been occurring since then, and the new Omicron variant, BA4 and BA5, and BQ, as we've now seen. Boosters are recommended for everyone 5 years and older, and the CDC recommends the Pfizer booster for those 5 years of age and older, and the Moderna booster for those 6 and over. And New York City still has their mobile test to treat program running, and it is running through all 5 boroughs, and they have antiviral treatments there. They have flu shots. They have all the vaccines there, and they're located in all 5 boroughs, and it's free. So you can go to vaccines.gov and find where those mobile test to treat pop-ups are if you wanted to go to there instead of going to a pharmacy or to your doctor. So the campaign that we're currently running right now at Young Invincibles during the holiday season is called FluBoo. And I'll share this video that we have before I go into explaining. But can someone let me know if you can hear this when I press play?
It's FluBoo season.
Did that work?
Yeah, we can hear it.
Okay, awesome.
Are you protected against illness this fall? This fall and winter, doctors recommend getting vaccinated against the flu and COVID-19 before the weather turns colder and more illnesses spread. Experts say it's safe and efficient to get both the flu shot and updated COVID-19 booster at the same time. Don't let the flu or COVID sideline you for the holiday season. Make sure you're protected this FluBoo season. Visit vaccines.gov to find both today.
Cool.
It's FluBoo.
Oops. Okay, so FluBoo. So as you heard in the video, FluBoo season is the final few months of the year where we enter flu season and are still trying to mitigate COVID-19. FluBoo is an extension of our Generation Vaxxed campaign with now an emphasis on encouraging young people to get the flu vaccine and the newly updated COVID-19 booster. All of the versions of the COVID-19 and flu vaccine are authorized by the U.S. Food and Drug Administration. And these vaccines are the best defense for you and your loved ones against the virus. Both vaccines protect you from getting sick and lowers your risk of severe illness and hospitalization if you do get sick. Some FluBoo 101. The what is most important to know is you can get your flu and COVID-19 vaccine at the same time, and it is safe to get them at the same time. The primary COVID-19 vaccine series is recommended for everyone 6 months and older. The flu vaccine is recommended for everyone 6 months and older. Severe side effects for both vaccines are rare. And common side effects, if you do get them for both vaccines, include soreness where you receive the vaccine, as well as fatigue, headache, and muscle aches. So there are multiple flu vaccine variations available. One variation is not better than the other, and they do all protect against influenza. And you can talk to your doctor, healthcare provider for which option is the best for you. And the risk of any severe side effects from the vaccine is less severe than the symptoms of the actual virus or receiving it. And I went through that really quickly, but I will stop here. If you have any questions, I have links up here that I will share in the chat, or if you want to screenshot this, just to find information on how to find the vaccine. The third link right here, nyc.gov, is for updated COVID information in New York. They update it daily. And my information is on here as well if you have any other questions for me or want to reach out after today's meeting.
Does anyone have questions for Brooke? Okay, thank you so much.
Thank you.
Okay, so I just wanted to remind everyone that we are on social media. We're on Instagram and Facebook. Our handle is East Flatbush Partnership. Instead of having our virtual monthly meeting next month, we're going to have our end of year celebration. It's going to be on December 16th from 6 to 8 p.m. That is a Friday. We normally meet on Thursdays, but we're going to be having this event on a Friday. It is an in-person event. You can expect food and fun and celebration. We will send out a registration link for that soon. So I just wanted to give you all a heads up, okay? So at this time, I would like to hear from you all regarding program updates. So if anyone has any program updates, feel free to unmute yourself and share out.
If I may start first, and then I have to leave shortly. I do wish to share, though, that the Fresh Air Fund, our application flyers are available. I put it in the chat along with my basic information. Our application opens up. The Fresh Air Fund is a free summer sleepaway camp for boys and girls ages 8 to 15. This will be our first summer where we've restored our programs back to our traditional levels, and that we hope to 3,500 kids. That's combined from Fishkill and our other camp in Harriman State Park called Camp Junior, which serves children from the Bronx. The application will be available in early February. We're putting the word out now so that parents can think about it, pray on it, and find the courage to do an application, and they're all welcomed. And we'll do the rest to ensure that the children have a fun, safe experience at the Fresh Air Fund programs. I've left my contact information in the chat. Feel free to reach me via email or phone call with any questions, and or if you'd like me to do a presentation in your community for your program. Okay, thanks so much. I appreciate you, Lameka. Thanks, everyone.
You're welcome, Anthony. Thank you. Who else would like to share program updates?
I'll go, Lameka. Yeah, hi everybody. My name is Raleigh Golson. I'm the lead organizer over at Impact Brooklyn. And in terms of updates, Impact is going to be hosting a free workshop on December 8th on securing repairs and heat and adequate heat during heat season. And also, just to follow up on what he was saying to parents of students, there's also the Design Works High School. It's going to be opening around the Pratt Institute area in Brooklyn in the fall of 2023, and it's going to prioritize Brooklyn students. So I'm going to put their info in the chat as well.
Thank you, Raleigh.
I'll go next, Lamecca. This is Vanessa Burrell-Warner. I'm reporting from New York's Department of Health and Mental Hygiene. I see that smile. So I'm happy to let you know that our virtual parent presentation is still on. It's going to continue from November to December, and that is for families with children from 0 to 3 who may have any suspected or known developmental delays. You can come into this virtual presentation. We do have a QR code that you scan and you select what day you want to come. So it's normally held 2 days a week and every other Saturday, and it's in the evening time, like 6:30 to 7:30, just 1 hour. It's delivered by experts in the field, so parents who come in can ask questions, and of course, providers, you are welcome as well. We talk about misinformation and concerns that families have. We have frequent asked questions that families have about referring their children, regarding labeling and all of these things. Free of reporting to ICE and immigration is mentioned. And then we talk about the early intervention referral process. We go through the referral form and we talk about the services that we provide because we are interested in children reaching their full potential. We do have 2 parts of the program. It's developmental monitoring for children at risk of a developmental delay. We go into what those at-risk factors look like, such as prematurity, low birth weight, things like that, other social, emotional factors we cover as well. So just come in. I'm gonna submit the flyer that is going to be distributed by Tamaka and the partnership. And please share it with other families in your community. This is a free program. Children do not have to be a US citizen to receive services, and we do not label any children. So you'll hear more about it. So thank you very much, Tamaka and others.
You're welcome. Who else would like to share program updates?
Good afternoon, everyone. This is Tyro McDonald from Neighborhood Housing Services of Brooklyn. Just quickly, on November the 22nd, we'll be having our afternoon home buying orientation. You can go to our website at nhsbrooklyn.org to register. I'll put this all in the chat. Also on Tuesday, November the 29th, we're also having a financial workshop on credit, developing a savings plan as well. So you could just go to our website at nhsbrooklyn.org if you want to register for it, but I'll put the flyers in the chat. Thank you, and over and out.
Thank you, Tyrone. Who else would like to share program updates?
Hi, this is Marwa from the Civilian Complaint Review Board. For anyone who does not know, the CCRB is a city government agency that investigates police misconduct. Really quickly, I just want to share some new updates for our agency, and then like an exciting opportunity for youth. So first, the updates just that the CCRB can now self-initiate complaints. The CCRB now has an entire team dedicated to investigating bias-based policing and racial profiling. And lastly, another update to our agency is that we can now investigate the misuse of body-worn cameras by NYPD. So yeah, those are just some general updates to our agency and our jurisdictions. And then the exciting opportunity for young people, we are actually, we are now taking applications for our Youth Advisory Council. So basically our Youth Advisory Council is a team of young people from across the 5 boroughs who are passionate and, committed to criminal justice issues and issues surrounding police community relations. And they work directly with us, the CCRB staff, to engage with other, young New Yorkers, and they serve as like leaders, youth leaders in their communities. And we, in different projects that we have them do. So yeah, if you know any young people who you think would be great for this program, who would enjoy this kind of work, please have them apply. I'm going to share the link in the chat right now. So yeah, that's pretty much all, it for my updates, and I hope everyone just has a wonderful rest of their day. Thank you so much.
Thank you. Who else would like to share?
Good afternoon, everyone. Hi, this is Keisha Sydney with Sesame Flyers in the building. Hope everyone is having a fabulous Thursday afternoon. Just wanted to share with you guys, we are getting ready to have our annual toy drive, which is happening on December 10th at our main office. As of tomorrow, our link will be open to the public from tomorrow lunchtime. I'm going to send, I'm sending you guys the flyer and the link so you guys can share it. We are catering for about 220 kids. We're also this year adding, senior citizens this year, and we want to cater for about 50 of them. So we're reaching out to you guys to see if anybody would be interested to donate toys and also to donate gifts for our senior citizens. Okay. I'm also gonna send the links out for that, because we do have a wish list that we put together from Amazon, which makes it easy. You can order from there and the gifts will go directly to mail to us. So you wouldn't even have to worry about dropping it off. So, and just to remind you guys that we still do have our programs up in operation. It's 3 locations, 2 in East Flatbush and 1 in Canarsie. I did put my information in the chat if you guys are interested in reaching out to get your kids to come out to it. We do have busing service right now at this time that we can bus kids from other locations to come there. Okay. Thank you.
Thank you. Do we have any other program updates?
Anyone that has a disability, any age, to services and resources. We also can assist with housing applications, 2010E, which is supported housing. And we also are hiring. So I had put my email on the chat before, but I'll just put it again for those who are have clients and are seeking for jobs. We are hiring 2 benefit counselors for Brooklyn and 1 for Manhattan.
Thank you. Any other program updates?
I'll take the chance this time. Hello, everyone. Wonderful meeting as always. I want to thank the presenters. Very, very good information. So in the chat, I posted 2 flyers. One is about now that Thanksgiving is next week, right? Let's make sure that we're cooking at the right temperature. We can also get poisoned if we don't cook our food properly, we don't take care of it or keep it in the right temperature. So take a look at that. And also with alcohol poisoning. If you ever have any questions, please do not hesitate to call the Poison Control Center. We are available 24 hours a day, 7 days a week, and we don't judge anyone when they call. So have a wonderful Thanksgiving.
Thank you. Is there anyone else that would like to share program updates?
Luke, I have a question.
Yes.
You said that you guys are having next month's event is like a mixer. Is there anything that we need to bring or anything like that, or we just show up and have fun?
You just show up and have fun.
Okay. And the dress attire, is it a formal?
Business casual. Okay. It's not formal. Business casual.
Business casual. Okay.
Show up, have fun, relax.
I was ready with my gown to put on.
Now you could wear a gown if you want to.
It's been a while that we haven't done, things like this. So, you get all excited. You have the clothes in your closet. You want to wear it, right?
No, Keisha, casual yet elegant.
Any other program updates?
This is Rhea Smith. How is everyone?
Great. Hi, Rhea.
Wonderful. Nice to see and hear all of you. Apologize, I'm not on camera. Just a quick update. Today, I am attending on behalf of Uncommon Schools as the Regional Director of External Affairs. We do have several openings and slots open for enrollment. It's quality education, free education. Obviously, now that I'm there, they're going to be rolling out also a number of culturally sensitive programs. I'm working with the High School 2.0 program to enhance some of the things that they're doing for the high school kids,
as well as we are interested in partnering with any of you that are on the call for a number of events in terms of turkey drives, school, back to school supply giveaways, toy drives, and other summer, winter, spring, and fall programming. So please feel free to reach out. I'm putting my email address in the chat and my phone number as well, which is my personal cell at the moment. But that's where I am 9 to 5. Feel free to give me a shout, and I'm very much looking forward to working with you all in that capacity.
Thank you. Any other program updates? Okay, I think we're all set for that. So lastly, as usual, I just want to share our catchment area, and then we'll have some time open if you all would like to collaborate amongst yourselves about anything you heard today, if you have any questions. We service zip codes 11203, 11210, 11212, and 11226. And I'm going to stop recording at this time, and feel free to unmute and ask any questions that you may have to our meeting participants. We are officially done. Thank you guys so much. Happy Thanksgiving.
Thank you so much for having this event. And please register your 3 events coming up, the Thanksgiving